I know nothing. I cannot tell anything about that.
You know nothing, Jon Snow. Some people chase strength, others lift expectations. No judgment, just symmetry. Hello,
Hello?
did you miss me?
Yeah, I know nothing. I cannot tell anything about that.
You know nothing, Jon Snow.
Hold on.
Yeah, because you kind of disturbing,
Does it?
Yeah, I think so.
Is it? Okay. Then I will go to my questions.
Yeah, please go on.
Doctor, what is pectoral implant?
Pectoral implant is our way to give man a muscle look in the pec area, because it's very hard sometimes to build up a muscle in the pectoral area. So you can do it by putting inside some implants.
If strength is internal, why do we insist on externally first?
Strength is internal, sorry. If the strength is internal,
Continue.
yeah, I didn't get it. You have to repeat it. Repeat the question, please.
I will pass. Do you think the chest now is being asked to represent confidence?
I don't think so. It's not about the chest, it's about the patient. Definitely.
Definitely.
Yeah. Exactly.
Okay. And if someone has pec implant, do they still exercise or is that now cancelled?
Yes, they have to. You do a surgery and the patient has to do much more exercise on it.
After the pec implant?
Yes, it's better or always better to do the exercise after the surgery. Likewise, when you do the abdominal area liposuction and you give the patient fake six packs, we place the pecs right on the exact place, like right on the muscle, and right on the exact abdominal muscle, because after the surgery, when they are exercising, they are going to know that it's going to be more defined when you do more exercise on it.
So gym membership is not cancelled?
No, not definitely not. Yeah, definitely not. You have to be, it is actually harder after to continue on your life after the surgery, because you have to be very careful about your diet and also about your gym exercises. I think so.
You think so?
Yeah.
Okay. Does it feel real?
Well, you have to ask questions to the partners of these patients. But what I can tell you about the literature is, yes, when the implant is covered with the muscle, specifically talking about these patients, we put the pec implant in between the muscles. You cannot touch the implant, and it does feel real.
Oh, you know that it feels real.
Yeah, because the feeling of touching and deciding that it is real is coming from the sensation, and this sensation is about if you sense the implant or not. When you touch, if you don't touch the implant, it feels real. It's all about that. So the aim of putting the implant in between the muscles is to cover the implant with the pectoralis major muscle, the biggest muscle of the pec, and then the patient won't be feeling any implant, but they are going to feel the cover muscle, and then it will feel real.
After the surgery, can patients just go to show to their chest immediately to the people, or
Yeah, I think so. They can show it immediately if they like. but they have to know that it's going to be a little bit swollen at first place. But you know what? I have operated on a patient who is a singer, and after a week, he was singing on the stage.
And showing it immediately, it's not considered rude as a medically? Or
Medically, I don't know. It's all about the patient's own perspective and safety issues. They can show anyone they like. I don't tell that they have underwent this operation to anybody else, but they can tell.
As gravity continues to exist, do the PEC implants
PEC
fight
implant,
against
no, the PEC implants, they do not move. You put it inside the pocket and they stay there forever because the pocket is exactly made for the implant. It doesn't move around.
it? And they do not fall down,
No, they don't go down. They are just, you know,
just staying there.
you create a pocket in between two muscles and you put it right inside there. It doesn't move.
So you're squeezing them.
Kind of, yeah, kind of squeezed and limited by the limits of the muscles.
And does the body live in the present or remembering the past?
It tries to remember the past as always, likewise your other questions in the other episodes.
Other.
Yeah. It tries to remember, but in this PEC implant, specifically talking about the PEC implant, whatever you do, the implant does not move so that you can call that it doesn't remember the old times. It's completely adapted to the new era.
And how do you decide the size in centimeters? Do you measure in millimeters, centimeters, or the vibes, or even a confidence?
It's all of them are, all of them are different factors, and
What kind of different factors?
yeah, the patient's will, the sizes of the pec muscle, because I have explained you that I have to choose an implant which should be exactly covered by the pectoralis major muscle. The size of this muscle is very important. So you have to put an exact size. It shouldn't be too projected because suddenly you might feel like it looks like a woman's breast. We don't want it unless the patient wants it, by the way. But for a masculine look, you should choose it. You should choose the projection. You should choose the sizes. You should choose everything.
And can people still feel hugs as the same way they had before? Or it's just symbolic?
It doesn't change any feeling and any sensation. It's not about the sensation. It doesn't damage any of your nerves under which supplies your sensation.
Oh,
It might damage some nerves, but it's just very deep.
so the feels is real.
Yeah, the feel is real, of course.
Okay.
It's like a breast implant. If you put the breast implant right under the breast tissue, which is totally covered by the breast tissue, whenever you touch it, you don't feel it. You don't feel the implant. You feel the breast tissue, and you feel like it is real.
Okay, I'm done.
Yeah?
Thank you. Yeah. Looks strong, feels complicated. See you at the leg day.